Hey everybody, this is Dr. Chris Kelch from Avondale Health Center in Avondale, Arizona. I want to talk about testosterone and ways that it is lowered. So, this information is taken right from a website here, a couple websites actually, and I encourage you to go to those sites if you want to get more information. I'm going to touch briefly on these matters, but I just like them. I like the information that was on them. We do testosterone therapy in our clinic. I'm a chiropractor, I'm one of the owners. So I'm not the one making the medical decisions, but we see these men walking through our doors every day. So I have a pretty good idea of what is causing their testosterone to be lowered. One of the things that we are seeing in patients is that a lot of times they're overweight. Now, being overweight is becoming more and more common in the United States. In fact, I think a majority of people are overweight or obese. So that's one way to lower your testosterone. Another thing is metabolic syndrome or insulin resistance. Diabetes would be another common thing. If you are diabetic, it's been shown that you might have, I think it's 25 to 35% chance more of having low testosterone. If you are drinking a lot of alcohol, then your testosterone is probably lowered. Okay, so one of the things that it recommends is limit yourself to 1 or 2 drinks per day. And that's actually been shown in some circles to be somewhat beneficial to your health, which is controversial, but you'll see it in a few places. Stress is very commonly associated with testosterone being lowered. If you have a lot of stress, if you worry about a lot of things, it'll be linked to a hormone called cortisol, which can lower your testosterone. So more and more people are stressed these days, whether it's financial or just the world that we live in. Lack of sleep is another thing. If you are not sleeping on a regular basis, if you have a night job, if you're like, let's say, a cop, a firefighter, you work a night shift somewhere, you're not making your testosterone the way you should because you're not reaching your deep level of sleep. One of the first common signs and symptoms is you have less morning erections. Depression's another thing that can be linked to low testosterone. Okay, vitamin A deficiency. Vitamin A deficiency, if you have a real severe vitamin A deficiency, it can be linked to something called night blindness. You get vitamin A typically in diets. Things like carrots will have that. Vitamin D levels. Vitamin D is a very common thing that's linked to low testosterone. Vitamin D is something that you typically make from the sun. But how many of you either don't go outside enough, live in a climate where you don't get enough sun, or you put sunblock on all the time? Well, if that's the case, if that's you, then your vitamin D can be lowered, and vitamin D is related to testosterone. In our clinic, patients are advised typically to take vitamin D along with their testosterone if their blood levels say so. Overtraining is another thing. If you exercise, that's awesome, but if you exercise too much, it uses some of your testosterone up. Testosterone is kind of like fuel for that. So there is a fine level or fine line of exercising just the right amount. If you're eating or exposed to different toxins like pesticides, marijuana, excitotoxins. Excitotoxins would be like food additives, MSG. I think things like Splenda and artificial sweeteners can actually contribute somewhat to that. Um, so that's something to keep an eye on as well. Kind of a tongue-in-cheek thing, talks about ways to lower your testosterone levels. Well, who wants it lowered? I don't think really too many people do. One thing I want to mention is soy products. If you are eating a lot of soy, whether it's in your coffee creamer or an additive to something you're eating, soy will mimic female hormones. So it'll actually lower your testosterone, especially if you're a man. You don't want to be eating any of that. You don't want to be drinking soy milk. So feel free to read that if you like. Low fat diets. All right, so there's a lot of controversy out there on that. It's really not fat you need to worry about, it's the type of fat. So you should be doing more olive oils, coconut oils, flaxseed oils, things that you typically find in most refined and processed foods are not things you should be eating. All right, let's go down some more. Some of the other things just touch on things we've already talked about. Well, actually, a lot of them do. So feel free, obviously, to visit this website as well. This will tell you some more information on testosterone. Now, in our clinic, if you have testosterone levels that are low, if you're wondering if you do have low testosterone, we do that in our clinic. We check that for you. So if you come in, we just do simple blood draw for you, see where you're at, and if you're low, then we talk about different options for you. If you have any questions about that, if you would like to come in for a consultation, please check out the link at the end of this video. Thank you.